Hi, my name is Michelle Olson, and I'm out here in Selma, Oregon. So the southern part of the state, where pretty much nothing happens. My son is 24, has severe autism, intellectually delayed, 6'6". Started out at 340 pounds. He's now right at about 240, 250, and pretty stable. So pretty much why I'm here is we just went through a 3-year medical crisis. In fact, I couldn't talk. I just started talking about August of last year. So that was pretty intense. We started out with February of 2020. My son pointed to his tooth hurt, and so I got him in. If I'd have known what was going to happen next, I probably wouldn't have been able to do anything different because I didn't really have a choice. Took him in to the dentist. He was beautiful because he always wants help, right? Got his x-rays and they're like, man, he has a molar that is a little something. And I'm like, but that's not where he was pointing. So he was pointing at his wisdom teeth, somewhere different. But they found something, so they sent us a referral. They sent us a referral. Got bounced around for another year. Nobody said, hey, let's just shortcut this. Let's send this referral to the one person who actually has, hospital rights in Southern Oregon. God, that would have been nice, right? There's really no protocol on that. The only protocol is one protocol, and let's just go boink, send a referral. They don't know where that stuff's gonna go. So it took me a year being bounced around, and by then, my kid, every time I'd say, hey, we're gonna go to the dentist, we're gonna get this taken care of, after a couple times of that, he's like, and it became harder and harder to get him in the vehicle. But I had to do it. Even if it was 110 degrees, at 1 o'clock in the afternoon, because these doctors don't really give two shits, right? If you're special needs. Hey, you know what? You just got to stand in line like everybody else. Well, all right. Let's try not to kill somebody on the way there. So that's the first year. We finally got it done in 2021, February 25th. PTSD remembers dates and times. And right as we're healing out of that, and I'm thinking, good job, now I can get back on track, and I can start working on, behaviors that arose, during 2020, doing it their way. Nah, by spring of 2021, my kid was going, I knew his gut was getting tore up, but I didn't know what to do. I'm no doctor, right? So I'm just kind of calling around. I'm like, gosh, this is allergies. Is this, does he have something going in his mouth? I'll never make it to Medford again. We couldn't make the follow-up appointment, which was in May. We got done in February. So by the time May came around, too late, right? Manic. So some things happened with me, emergency surgery, septic, whatever. But, I took 12 hours to go to the emergency room, then came right back up, get my ass kicked just to start all over again in a manic position. So by, See, I get triggered. So by end of May, end of June, we were in the hospital. I couldn't make any appointments, and his primary said, you got to take him to the ER. Well, that was just the worst thing I'd ever heard. I'd never hit the ER with my kid, and I couldn't imagine trying to do that. And then guess what? We had to go by ambulance, which means we had to call the sheriff's department to make it okay, because we were manic, for, the ambulance people to come in. So, it was great. Actually, my kid was really good, and, he rode because he thought he was going to get some help. But, that was just a farce. That was another goddamn lie that I told him. Because all they did was bump him, tell me he was schizophrenic, bipolar, and all kinds of shit that they didn't have any, who are they? You don't even know how to treat my kid. Don't even talk about diagnoses at this point. Where are you? So I left him there for 5 days, which I knew was going to be just hell for him. Because I abandoned him. I came every day. They're like, oh, the hospital staff's like, oh gosh, he's great, la la la. I'm like, that's because he's doped up. He's still got the same issues because nobody's even acknowledged that 5 days later, 4th of July, I picked him up, just dope him up. And they had called Rogue Behavioral Health. Yeah, they're wrong. So, yeah. And then sometime October 2021, that's when all the doctors decided to retire, you know, because of pandemic stuff and the shots and whatever. And all power to them, right? It sucked. So here we were. And then we were out without a PCP for another 10 months. And then we finally got one June of 2022. All right. And then I had to like build a relationship with her, which I'm glad I did because it took a while. So after going through dermatologists and all this stuff, and my kid was gaining weight and throwing up. Oh, by the way, he started puking in spring of 2021. He vomited and shit himself profusely for the next 2 years because he was undiagnosed. What he had was H. pylori. And you know, it would have been nice if those sons of bitches that actually worked on his teeth would have sent out a warning. Hey, Michelle, you know, if you start seeing disruptions in behaviors or any of that, you know, these kids, because they scratch their butt and they pick their teeth and, you know, all the things that I already know. But I'm not a medical doctor or anything else, you know. That's where it ends. I stay in my lane, the autism lane. Not my job on the other end, but then I had to learn that part. But anyways, that's another. So they need to come with a warning. Because nobody believed me when I said he's got problems somewhere in that GI tract. I don't know where to start. Disregard autism aggression. How about, hey, you know, it just really sucked. So January of 2023, got him in for a second endoscopy. Oh, because he had one in 2021, August 4th. That would be my birthday. That's why I remember that date. Now they just, you know, I was in there and my kid was, you know, getting sedated and all this stuff. And some son of a bitch comes, oh, a whole lot of something for a whole lot of nothing. I was right there. That was the second time I've had a surgeon come in and say stupid shit like that. I had to play nice because I needed them to help my son. I could do without their attitude. After 5 minutes and get out. But that didn't happen. No, it kind of did. Oh, well, there's some omeprazole. All right. Another 2 years. Yeah. So H. pylori, his system's entirely messed up, and all the medical community wanted to do was dump pills. Right? What do the pills do? They deplete your body. They're going to irritate all the other shit that's going on down there. So we need to fix it, which is why I go organic, right? I even went cannabis, right? Because the white pills, they don't have a label. They have a label, but they don't say what's in it. So we're a part pharmaceutical and we're a part cannabis. And yes, I test my plants and I've learned all about that. So, you know, that's a little bit more than the medical community can say about their white pills. Now I have, at least with the providers that Eric's working with, an understanding, but it took a lot together to get there. And in January of 2023, I got sick of the medical community, just keeping it a little roar, you know, let me go to the next level of whatever it is, and, you know, hired a nutritional therapist, and then we started working on from the inside out, which is what should have been done, right? Nah, that's not what they do. So I feel like we've come out of the medical crisis, but it was no help to really anyone. It was me reaching out and me screaming. People who have severe autism, time is of the essence. So once you start seeing an escalation in behavior, that's a form of communication, and so you're supposed to listen. And what's frustrating to me is when I call someone to say, hey, you know, I think this, you know, da-da-da-da-da, you might need to, you know, make an appointment and say, hey, this is what, you know, we need to try and have happen. How can I do this? You know, and we need to get it. So trying to go to a intestinal person or something, because, you know what, GI issues are like one of the freaking autism 101, you know, they're gonna have it because they eat like crap. All right, how do you get there? Especially when they don't even do virtuals, you know, because I can't take my kids somewhere. So, you know, it'd be nice if they would compensate like that, and then you can get all the paperwork done, you know, via mail. You can do, you know, with their height, their weight. I mean, I can even take blood pressure. We can show you how. My daughter's a CNA. And then, you know, discuss all of that virtually, because otherwise, if I'm sitting in a clinic, all I'm doing is I'm not listening to anybody. I'm protecting their staff and all their shit that costs a lot of money that I don't want to have to pay for, you know? So that would be nice. Thanks. Thing that would help, you know, families is if if you walk through the door and just didn't get judged, profiled, and thrown to the side like you're stupid.